MeRes100 is a 100 micron strut thickness bioresorbable scaffold. We till now have had the first generation of scaffold, which were 150 microns thick. These were large devices with a number of limitations to them. Most importantly, apart from being difficult to use and having specific techniques of implantation and limitation in sizes, etc., one of the biggest, and poor deliverability, one of the biggest deficiencies was also their safety, the high scaffold thrombosis rates. And it's been seen that the thinner we get, we can actually make these devices probably safer. This is the first ever 100 micron strut thickness bioresorbable scaffold, and I'm proud to say that it's actually been made in India, researched in India, developed in India. There are some very fascinating characteristics of this MeRes100 device, which has not been seen in the previous first-gen scaffolds. Apart from being thin struts, it's also got a unique architecture of closed cells at the edges and open cells in the middle, and that actually provides access to the side branches, ability to dilate side branches through it. It is a sirolimus eluting device, and therefore it's made of a PLLA blackbone, and the coating is, the sirolimus is coated onto a covering of PLLA. It elutes that in a similar manner as Cypher used to do, and therefore it's fairly effective. But the bigger advantage is that it comes in a variety of sizes, going from 8 to 48 millimeters in length. Until now there's been no scaffold of 48 millimeters in length, and comes in a variety of diameters up to 4.5. So actually it mimics in many ways a present generation of metallic drug-eluting stent. We were able to do the first in-human study with this device. The first in-human study was a 108 patient study with predefined endpoints of both efficacy as well as safety. The primary outcomes which were presented last year showed that this device had extremely low late loss at 0.15 millimeters, which is as good as the best-in-class metallic drug-eluting stent. It also had complete, by OCT, 99.3% strut coverage. At CT angiography at 1 year, stents remained patent. On clinical follow-up over 1 year, there was only one ischemia-driven TLR in the 108 patients, and there was no scaffold thrombosis. Today we presented the 2-year data, and the 2-year data demonstrates that the extremely favorable late loss, the extremely favorable OCT and IOS findings seen at 6 months have all been maintained up to 2 years. And as far as clinical follow-up of these patients is concerned, there's been only one additional ischemia-driven TLR and no scaffold thrombosis. These extremely favorable results and extremely encouraging results form the basis of the major pivotal 2,000-patient randomized study randomizing MeRes100 to a Science everolimus eluting stent in 2,000 patients to start in the 3rd quarter of this year.